Hi, everybody, and welcome to DEARG, the podcast that brings you information about endometriosis and adenomyosis. Today, I'm joined by Dr. Alan Gaffney, who's a medical doctor, an anaesthetist, and an intensive care physician who works here in Beaumont Hospital in Dublin. And tonight, we want to talk about something that's very exciting in the social media world, and that's the introduction of the telehealth app and service, not just for clinicians, but for patients also. So, Alan, do you want to give me a little bit more about your background and maybe tell us some more about the telehealth application?
Yeah, thanks a million, Kathleen. So, as you said, I'm a practicing doctor. I'm an intensive care doctor working in Beaumont Hospital. So I look after sort of the sickest of the sick coming in to Beaumont Hospital. A part of my job also actually is to be the clinical lead for organ donation in the kind of northeastern part of the country. But one of the things that I sort of was interested in from a very early stage was communicating with patients. And in fact, that's one you might not think we necessarily as anaesthetists or intensivists communicate usually with patients, but we certainly do with their families. And no matter how good we think we are at communicating, it is just amazing when families come back to you and tell you that, look, they only picked up a tiny proportion of what you spoke about. So I don't think we're particularly bad at it. I just think that we don't understand that it's a different type of communication that happens when somebody is in like a really stressful situation. So that whole area of communication kind of interested me for a long time. And then I suppose I'm sure most clinicians would feel the same way, that during COVID, there was an awful lot of information out there that was just completely blatantly wrong. Now, we were really busy. We were looking after patients day in and day out, but it was a little bit annoying to hear some of the things that were being said about COVID and about care of patients and that type of thing, mostly, of course, on social media. But doctors aren't great on social media. If we do go onto it, we'd go onto it in small numbers, and we often do it in a kind of a more personal capacity rather than a professional capacity. And if you do want to get your sort of voice out there, there are a lot of people just waiting to kind of knock you down. So a lot of doctors, although they were annoyed with what they saw, didn't necessarily get onto social media and back up their own sort of medical opinion and things. So because I was interested in communication and because I was interested in technology, myself and my co-founder, Nick Nesterov, who's basically a technology background, decided that we'd address this by putting together a new social media platform, a social media platform that would be solely for clinicians to actually lead the conversations, but open up to the whole world. And one of the kind of interesting things about this is that, and this we had kind of come upon this idea even before everything that was happening with Twitter and now with AI, is that we recognize that authenticity is so important and expertise is so important. And this is at a time when people, there wasn't a huge amount of authenticity around. We had, in the US side of things, there was a lot of, and in the UK for that matter, a lot of people saying that, stop believing experts. Experts think they know everything. But we actually felt that it was kind of reasonable in this situation that experts would talk about something that they were expert in. And so that's the reason we decided to put together this platform called Tell, so that we could actually speak as a group of expert clinicians about all sorts of topics and that the public then could interact with us. So I suppose that's just a little intro as to how this all got going, Gaffney.
And we know that medical misinformation doesn't just stop on social media. It has real potential for harm within, not just, the patient community, but the wider social public health as well. And it's great to see that you're tackling this head on and sort of at source as well too, by taking in clinicians who are experts in particular areas. And one of the things that I find within the endometriosis community is that we have met with a lot of misinformation online. And, in a lot of the sort of studies that are done around the use of social media as well too, that trust is not there. So I think to have a validated platform would be very important, where that the people that you're actually speaking to are clinicians, or that the posts that you're reading are actually from verified clinicians. So could you take me a wee bit through the verification process? Can anybody apply, or would you have to show that you have a medical license? What's that process like?
So the process at the moment, so we're a US-based company. That's the first thing, and so we're concentrating at the moment on the US market. But that doesn't mean that people can't access it from other countries. But generally what we would do is, first of all, you have to be a clinician who is registered on one of the state medical boards in the United States. And that would mean that you would have a valid license. Now, so when somebody comes onto the app as a clinician, they fill in their details and they associate themselves with their place of work, which is another really important part of verifying that this person actually is who they are, but also that when they're speaking on the app and they're speaking to the public, that they're always thinking to themselves, I'm associated with my institution, so I have to be careful what I say here. It's not only me personally speaking, but it's me on behalf, or at least with my affiliation there with my institution. So they have to give their own details. We check their medical license. They have to give an email address from their own institution, and we verify that. And at that point, we know that we have an actual clinician, whether that's a doctor or a nurse or a physiotherapist or whatever, on the platform. What we don't know is if that person is going to behave or not when they come onto the platform. So we have a lot of features that are built into this that encourage people to behave. When I say behave, what I mean is that they speak in a respectful way to their audience, and they deliver medical information that would be considered by their peers to be acceptable medical information, that it's not too far on one side or the other extreme of medical information. Now, it doesn't mean that you can't talk about new and upcoming, research that you might be doing or that type of thing, but for the most part, it must be pretty much within the ditches, as we would kind of say here, that things aren't too far outside. So the way we make sure that happens is that, number one, you have a physician in the first case, or a clinician who's affiliated with an institution. As I mentioned there before, if you're affiliated with an institution, you don't want to start saying things that your institution wouldn't disagree with. Then the next thing is that when you start posting, everyone in the world can choose to like those posts if they want to. And that then obviously makes it more likely that people will actually read those posts. But only other clinicians can actually recommend posts. So that is another way of just making sure that if there are clinicians that are saying things that aren't kind of held by everybody else, they won't tend to get recommended by other physicians or clinicians. And so their post won't make it too high up in the feed. The next thing is that if you feel as a general person or as a clinician that what this person is saying is incorrect, you can actually report that post. And that post then will be discussed internally by our overarching medical board. The next thing is that as a physician, you might decide, well, look, what they're saying is generally right, but I'm not 100% sure it's good enough to be getting out to the public. And what we'd like to do then is ask our peers to review that and give some feedback to the person, which again makes it more likely that somebody will write something that is acceptable to their peers. So when you put all of those things together, what you have then is a clinician from a recognized institution who's giving information that can be and that person can sort of be shown to be doing things that are right or wrong, depending on what way the community reacts. And then, of course, the most important then at the end is that the whole community can comment on this person's posts. And that, again, is important, because if somebody is saying something that you don't agree with, you can go on and you can say something, you can put them right. So, for example, when you talk about misinformation in general about endometriosis, a lot of people are talking about a subject and they mightn't necessarily mean to be, passing on wrong information. They might use wrong terminology or something like that. And you then, as an audience, can put them right. And you would hope then that you would see that person then would change how they would present themselves and present their topic that would take on board that. So we just want it to be a place where you can trust the people and you can trust the conversations, and you know that everyone's going to behave well with each other.
And that makes sense. And certainly when we look at other social media platforms, moderation has fallen down. quite badly in a lot of areas, and that trust is broken down as well too. And we see even on some of the newer apps where there's a lot of impersonation. So it'd be fantastic to have something that has that sort of verification behind it, plus that continuous monitoring as well. I think it's important for me. And I like what you're saying there about the community being able to comment and sort of give feedback as well too, because within the endometriosis community, we have some very strong advocates who are very vocal and very good at helping to correct some of the misinformation that's out there. And it's always encouraged to be in a very polite and a very scientific and a very structured manner. So we will always, introduce ourselves, let the person know maybe what the point of misinformation is, and maybe back that up with some resources. And often it's down to a misunderstanding. The most common one is, endometrium and endometrial like, and people don't often understand the implications of that. So to have a platform where you could have that sort of polite exchange and also share that information where other people could read that as well too, I think is very good. I would look forward to seeing something like that. So from a patient point of view and a user point of view worldwide, if we think in particular for something like endometriosis, where we have, 200 million plus people living with the symptoms worldwide, how can you see this being used, not just for endometriosis, I suppose, the topic, but a lot of women's health?
Yes, so I think one of the big things that's happening in the last little while is the sort of advent of artificial intelligence. And the reason I just bring this up is that with artificial intelligence, and we've all seen the various advertisements, where you can, in real time, change your pictures. You can, if you have a picture of your family and somebody isn't smiling, the AI can go to your laptop, pick up or your phone, pick up a picture of where they are smiling and change their smile. So the authenticity of things is becoming, it's really, really hard to know what's in the next number of months, what's going to be real and what's not real. Like you literally won't be able to tell the difference between fact and fake. That deep fakes really will be fake. So what we're going into over the next number of months and years is a period where you really, really don't know who to trust. And I think what's going to happen with social media is that's going to be amplified in social media. So people are going to be looking at the big social media platforms and wondering, can they trust anything that's on them? So I think what's going to happen is that we will see more smaller social media platforms, for all sorts of things. We've already seen it with, for example, Substack, which allows authors to publish and for people just to come to that platform just for, to look at particular authors. Or, there's ones you can look up for recipes and things like that. So all of these big platforms, yes, they're going to stay there, but there's going to be room for the smaller ones that actually are of interest to people, but more importantly, that are actually authentic. And so what we would imagine will happen over the next number of months is that people who are looking up things like endometriosis on the regular social media will go so far, and they probably won't go any further than that, and they'll see some things. But the people that want to go a little bit further, we think will come to social media apps like ours. And the reason for that, I think, is apart from the authenticity, it's the fact that you can interact with somebody. So it's very, very hard to interact on Twitter, for example. You have to be more or less, unless you do a direct message, which most people won't allow in this kind of space, you have to be very open about it to the whole world. And the likelihood of actually getting a response from anyone is pretty slim, especially from a real expert. So I think what people have is they have two options. They can either have an online visit with a clinician, or they can meet them in person. Or they'll have the other option then of going to a place where all the experts are talking about something that's interesting to them, where they have a kind of a front seat to this, while they can just essentially eavesdrop on these conversations that will be had between experts. But not only that, but then they can start interacting. They can look at the posts, they can look at the comments, but then they can start putting in little comments. And we allow a function on the app that allows you to become anonymous. So you have to be a real person to be on the app, but you can anonymize your name so that you can talk about something that you necessarily don't want other people to know that you're even interested in. So I think that's going to be the most interesting thing over the next number of months and years, is the fact that I think we're going to draw and attract people that really want to meet real experts and interact with them. And I think that's what's going to set us apart from the other social media apps.
Yeah, and can you tell me a little bit more about the verification process there for the end users, the non-clinicians? You mentioned there about verifying that they're a real person, and we are all getting a little bit more cyber security focused now. Can you take me just through that process there, just so that we would understand how that would work?
Yeah. So the first thing you do when you log on is you give your details. And that includes a date of birth, because we don't want any, at the moment, we don't want any children on the platform. You sign in, you use your own email address, but you have to use your own telephone number. So at that point, the good thing about this type of a platform is that it's unlikely to attract too many people, people, first of all, that aren't interested in the subject, but also it's unlikely to attract bots or that type of thing, given that you need to have an email address and a telephone number. When you do get onto the platform, then you can read all the comments. You don't have to interact in any way. But if you do want to interact, you're given the choice at that point of using the name that you signed up with or using a different one. And you can choose to use whichever one you want. We know that generally people will sort of put themselves forward as themselves. But what we can do as a clinician posting on the platform is we can remove users who don't, I suppose, behave within the rules when they come onto the platform. So the likelihood is that the vast majority of people that will be on it will be real people, and they can only put in a pseudonym if they've already signed up. But again, we have a pretty low bar to kind of get to at this point. We have to be better than what's out there, and what's out there is pretty bad. Now, it's not that we're aiming on the lower side, but there's also always that problem that you don't want the bar to entry to be too high for people. You want it to be as easy as possible to use the app, and not necessarily have to be too stringent when it comes to verification, especially on the user side, because there's a big difference between what's said by the clinicians, which is 100% verified, and then commentary and questions by the general public. You just don't necessarily want to have it too stringent for the general public, but at the same time, you want to make it so that it's most likely that people will use their own names or a pseudonym once they do that in the first instance.
That makes sense. And I think, like all of us have used social media and all sorts of health fora over the years, even back in at one point not, we probably were asking the questions that maybe other people wanted to see as well. So it's nice to have that community engagement, isn't it?
Yeah.
And it does keep the conversation going, because most times somebody has asked that question or they've, very similar issue to yourself. So it's nice to see that sort of, set of comments, even if it's a pseudonym or a name beside it, gives it a wee bit more sort of, gives you more confidence as a user, I think. In terms of health information, and again, back to the sort of cybersecurity thing, we are getting, again, very conscious of our health information and anything that would be shared. So I'm assuming that the app is compliant with the GDPR and HIPAA regulations and all of that as well too, or is it that there's no personal medical information shared? How does that be governed?
Yeah, so there should be no personal medical information shared on this part of the app. Now, there is a direct messaging feature only for clinicians and their own patients. That's part of this app, which is fully GDPR and HIPAA compliant. But the social media side of the app, from that point of view, there shouldn't be any personal medical information on it. And I think clinicians are pretty good now at making sure that they kind of flag these. So if somebody asks a very personal question, they'll usually precede their answer by, look, I'm not answering this, your particular problem. I'm going to talk about it in general. And if you have any particular issues, you should go and see your own clinician. So we shouldn't have any medical information on it unless somebody puts it up on it inadvertently or doesn't mind that it's up there. But our clinicians will remove that and have the ability to remove that. It's probably better for everyone that it's not up there. Yeah, so once it's clear to everyone that there is no personal information to appear on the social media side of things, then I think that's as much as we can do, other than encouraging clinicians to take it off if they see it.
Yeah, no, that makes sense. And in terms of the app itself, is it, purely textual based, or will we see like a combination of videos and images, or how will it appear to the end users in particular?
Yeah, so it'll look very much like the social media apps like Twitter, or not so much Instagram, which is more video related or video based. Possibly a little bit like LinkedIn. It's hard to know yet. As this develops over time and as more and more clinicians use it, we'll see the app kind of morph into one shape or another. At the moment, you will see text-based videos. You can even upload audio files. So all the usual things that you would expect on social media. So, and the more interactive physicians that we have on board will use more interactive media. And everyone is slightly different. It kind of depends. If you're just browsing through something, you might want to see short text or short videos. If you have a problem and you really want to get deeper into it, then you might be more interested in reading text-based messages or posts. And then, of course, they can link out to the outside as well. So even though you go into one post, you might end up reading an article, but at least you know that the article that you're being referred to, you're being referred by an expert and to an article that's probably something that you can understand, rather than a research article, for example.
Yeah, no, that's very beneficial, because it's, oftentimes we see things reshared maybe, and, research is very sensationalized. So if it's been shared by somebody who's a good understanding of it, it'd be nice to be able to trust that article. And I'm sure as well you're going to use like hashtags if I wanted to follow the topic endometriosis, or if I wanted to follow a particular clinician. Would that be easy enough to do in the app as well?
Yeah, you can do that. So you can follow any clinician. We have hashtags as well, and then you can share posts outside of the app as well. So there's cross-posting to other platforms if you'd like to share it.
Brilliant. That's a very exciting feature, actually, because again, we have a lot of patient groups all around the world on the different social media platforms, and some have them even through their own WhatsApp groups and that as well too. So to be able to take, good, accurate information and share that out, like, would be very beneficial as well.
Yes.
So, Alan, where do you see TEL going in the next couple of months? Do you see, an influx of users worldwide, or you say you're starting with the US? Could you tell me a bit more about that side?
Yeah. So from a business point of view, Kathleen, like any sort of new project, it has to start, with baby steps, and then get to the point where we hope it'll be the biggest medical application or platform in the world. So we have to be sort of strategic about how we do it. So that's why we've chosen the US as the sort of place to base it. But as I say, it doesn't mean that anybody from the outside the US can't access it. It's just where we're focusing our efforts. We're also focusing our efforts on women's health. We know that women access the internet for women's health, for health topics, more than men. And we also know that it's there's a dearth of information, essentially, and lots of misinformation. So it's a perfect platform to start off with areas like endometriosis, where there might be some misinformation, there might be just some lack of understanding, and then just people not being able to get information or just not being able to access it. So what we're doing is we're starting with that topic. We're then going to add on other women's health topics such as PCOS, and continue to add topics as time goes on. We will open up the app to everyone in the US. It's also open in Ireland and the UK. But most of the physicians you'll see on it will be US based. But that doesn't mean that we can't, encourage anybody from other places to come as well. It's just from a strategy point of view, we have to kind of think about how we're going to go about doing it ourselves. And what we expect then, as the numbers grow and grow over the next number of months, that we'll find that we'll get to a sort of, as I say, an inflection point, or a point where it kind of takes off on its own. And we just have to guide it and make sure that it stays, it does what our mission set out to do from the very beginning. So we would expect and hope that within the next number of years, that this will be the go-to platform for all medical information. That social media is how people consume information now. And so we're all used to having this information on the phone. We're all used to the social media type posts. But this is going to be different. This will be something that you will go on to if you've got a big complaint or a small complaint, or you're just curious, but you'll be able to see actual doctors discussing the topic that you're interested in and interact with them. And so we really want this to move from the US worldwide and in every language. And that's our big aim for this.
Like, that is fantastic, and I really look forward to seeing that, and certainly into getting the endometriosis community involved as well. I think it's a really good clean slate, certainly from a women's health point of view, to start from a very good basis, and with people who are very interested in the topic and who have a genuine want and need to communicate accurately in this field as well. So congratulations. I think it's a fantastic achievement, to get it this far and to get the product out there. And, I think there's great room for it, amongst everything else that's out there at the moment. So Alan, where can we find more information about this? I'll put some details in the show notes. But if you want to give us the website there as well that people can have a look at.
Yes. So if you go to tell.health, that's tell.health, that'll bring you to our website. And on the front page, then there's a button to download either for Android or for Apple. Or if you just want to go directly to the App Store, just put in Tell Space Health, HEALTH, and that'll bring you to the app. And you can download it and use it straight away and start looking and seeing what people are talking about already.
Perfect. That is brilliant. Alan, thank you very much for joining me this evening, and it's been great hearing about Tell, and I look forward to seeing how the app develops, and I will be interacting myself on it as well, and hopefully meeting a lot of the community on there. Thank you everybody for tuning into this episode of DEARG, and we hope to chat to you again soon.